elaboration of 31 clinical common conditions of the children in terms of its diagnosis, in terms of its dosha classification, in terms of its prescription is mentioned in this book. Clinical Pediatrics in Ayurveda. And just have a WhatsApp with it. You will get it by post. Why this I am winding up? Because of my Gurutvam, Stabdhadangeshu, Glarir Varnasya Vedanam, Tantra, Nidra, Vada Shobham, Velam Vyavadi Lashnam, because Atte, Adi Samshobham, Ati Hasanam, Ati Kathanam, all these are causes of Ojashayam. So, if any discussions are needed, please let us have some time for the discussion. By this I am winding up. If you got any idea from my presentation, that is due to the beauty of our Ayurveda. If you are not clear about any of the idea regarding the management by telling this much, I admit it is the problem of Dr. Dinesh Kair. So let us have some discussion in such unclear areas. And once again, I am extending my love to all the team behind the Rekha and Ayurmap for giving me such a wonderful chance. Thank you. Thank you once again.
First of all, let me thank you, sir, because it was a wonderful session. Actually, I have attended your offline classes also, so I really am happy to see you again. And your class is like a glass of boost. If you drink that, it is like you from tomorrow onwards will work hard. So you have given us, passed on your energy to us, even with your Pratishaya. Thank you so much, sir. Thank you very much for this wonderful session, sir. Now, with your permission, sir, can we go for the discussion?
Dr. Neha Sahu is raising the hand.
Yes, Neha, you can speak.
Good evening, sir.
Good evening.
Sir, I want to ask, in which age of children we can start to give Asav and Arishta?
From the very birth itself, we can give, no problem at all.
Sir, I can't get it.
From the very birth itself, you can give Asavarishta says Prasha. I am giving it. There is no contraindication for Asavarishta in terms of age. The contraindication for Asavarishta is in terms of Prakriti, and in terms of Prakriti, you are not supposed to give it in Paitika Vikaras.
Sir, one more question. What is ingredient of Niopayams?
Dr. Radhika, that Jiraga Bella, that yoga has to be put forward from the Sastra Yoga. Make a screenshot of it and share it in the group. We will give it in the group.
Yes, I'll put it right now.
Because by telling you won't remember it. That's in a specific.
Sir,
yes.
What is dose of Indukantam for hypothyroidism in children?
See, generally the dose of every kashaya, in my terminal, in my practice, is different. And this is the reason why, because I mentioned that in the one chapter of that book. In 1 month, 1 drop, 2 month, 2 drop, 3 month, 3 drop, 4 month, 4 drop, 5 month, 5 drop. Whenever the solid food starts, 2 ml up to 1 year.
Okay, sir.
And from 1 year onwards, you can increase 1 ml each. In 5 years, it will be 5 ml. In 10 years, it will be 10 ml.
Okay, sir. Thank you. Thank you so much, sir, for a wonderful session.
Thank you, sir. Next, I'll just read out a few questions have come in the chat box.
Yes.
Okay, sir. First question from Nalini Booth. 10 years girl, she passed stools with 2 days gap and at night. So how can we treat?
If the child is not having any abdominal pain, if the child is taking all the food, If the child is running here and there with the proper energy, 2 days is not a big problem. Only give hot water and give with the kanji. That is paya
Okay.
sufficient.
Okay. The next question, sir. How to treat Karshia in kids?
Karsha, that should be defined. You just log in www.simulconsult www.simulconsult.weight.com. That's a good app, good site to calculate the Karsha.
Sir,
Simulconsult. I will type it.
Okay. Okay. Thank you very much.
Simulconsult.
Okay. Okay.
If it is less than third percentile, if the weight is less than third percentile, because in common practice, everybody don't have the road to health chart. Everybody don't have the third percentile chart or anything like that. Everybody will have the mobile. So get into this Simulconsult. Height, weight, and head circumference can be measured. If you are putting the data, you will get less than third percentile. It will show 1 percentile, 2 percentile, 3 percentile, 4 percentile, 5 percentile. How much percentile is the weight, height, and everything. If it is less than third percentile, then you can treat. Otherwise, don't treat because it is normal to you. And if treatment is needed, always Lekhu Sandarpanam should be the line of management. Lekhu Sandarpanam. So always you should give Divanabhajana drugs like Rajandyadi Ashtachurna along with Lekhu Brahmanam. Lekhu Brahmanam, for example, as I told you, Mahesha Dravagam. Otherwise, Ashwagandha is Lekhu Brahmana. Not Gritas, not Lehias, not Avalehas. Try to give Arthas. Along with that, Snehasveda externally like Lakshad. And give plenty of good food. That is the best way to treat the Karsha. So, I have a food chart I usually give. Daily half glass of milk, diluted milk. Daily 1 banana, daily 1 egg. Thrice in a week, green gram sprouts. Thrice in a week, ABC juice. ABC juice means apple, beetroot, carrot. Thrice in a week, green leafy vegetables. Thrice in a week, butter. This will come as Lekhu Sandarpana Brahmana diet.
That was a very elaborate answering. Thank you, sir. Sir, next question. Can you please suggest how to treat stammering in kids? Will speech therapy also help?
Not only speech therapy. Actually, every stammering case should be managed along with Sira Snayu and Kaphavrata Udana. For example, Rasovanadi, Dashamulagadutrayam. These are the usual drugs which are prescribed by us, not the Sarasudharishtam. And Mugalabam with the Kalyanavaleha Churnam. And along with that, try to give speech and behavior therapy. Because without behavior, speech therapy is not at all working. If one child is not having speech, हमने speech therapy दिया, speech therapy देने के बाद गाली देना शुरू किया, तो क्या करें? So, speech therapy should be always coupled with behavior therapy. Then only it will be effective.
Okay, sir. Sir, another question. What precautions should be taken while using RESA medicines in children?
I am a practitioner who uses very minimal quantity of Rasa Aushadhas, but still, whatever the precautions told by Rasa Acharyas should be taken into consideration. This is the only way I have to say, because my Rasa Guru, just like Bhishma and Agalabhya, my Guru is the Chil Shashidharan sir, Shashi Kumar sir, and he is guiding me for a very formulation whenever I am using it. So I blindly follow that because Rasa Aushadhas are not Vyadhi Pratyani, not Hetu Pratyanika Chikitsa, they are Vyadhi Pratyanika Chikitsa, Jara paracetamol nyaya. So whatever they are telling, that should be taken as granted.
Okay, sir. Sir, we have one participant who have raised the hand. Dr. Ujjwala, you can speak.
Hello, good evening, sir.
Good evening, Ujjwala doctor.
Sir, you have told about that Karshap patient treatment. Means if so many parents comes and they come to just tell us to increase the weight of their kids. Like just they don't have any fat in their body, just too much lean patient. Sir, you told first Deepan Pachana, and after that you told Ashwagandha. Only Ashwagandha, which form we should give? Only Churna?
No. Yes. Initially, you diagnose it is proteinuria malnutrition with this carcia.
Okay.
Okay. You diagnose this, don't the parents. Second thing, stop the recurrent infections if it is carcia. Recurrent infections means recurrent respiratory tract infection is a common condition which sets carcia in. So try to prescribe Regenera Churna septil like syrup initially for 1 month so that the child will get a sufficient immunity and appetite. So the child will be prescribed with the diet which I told you. And after that, you try to prescribe the preparations like Ashwagandha, Mahishadra. Ashwagandha usually prescribed in the form of tablets or in the form of granules or in the form of powder and not in the form of Aristasavas because all these children are predominantly pitta in type. So I don't prescribe Aristasavas usually. So churna, tablet, and granules. These are the forms which I am using.
Sir, can you use Shatavari granules?
Shatavari is Snigdham, Shidam, and it is Brahmana in nature, which is causing Agnimal.
Okay. Okay.
You
Thank
take Legu Santarpanam. This is what I told.
Okay.
You take the papaya, which is not too ripened. Before that, if red color comes, you take it. That is Legu Santarpanam. If it is too ripened, it is Guru Santarpanam.
Yes.
Similarly, everything has to be divided into Legu Santarpana and Guru Santarpana, out of which Karsya is in need of Legu Santarpana.
Okay, sir. Got it. Thank you, sir. And sir, some kids they will come with headache, severe headache, and they want means they will take Dolo tablet and like that. Today only one patient came to me, 13 years old girl, and since 5-6 years she has been suffering from. She told like migraine symptom, but I don't feel like it is migraine because she has full headache and her ahara is very guru, like milk, junk food, chips, everything was there in her food items every day. Full morning only one glass of milk and no exercise. Obesity is there, and she needs like dark room whenever she get a headache. And MRI everything was done, it was normal, nothing in that.
1 second, Ujjwala. Just a second. I think there is some connection problem with sir. Just a minute, Ujjwala.
Okay.
Yes, the sir has some network connectivity issues, so he'll be joining soon. Okay.
She was.
Okay.
Ujjwala, you can speak.
Hello, sir. Sir, that girl is suffering from childhood, that headache problem. And her, when I took her history, her ahara was all santarpanjanya, like junk food, cake, Cadburies, and all. Means almost.
How much is her age?
Sir, her age is 16, sir.
Yeah, that is actually it is actually the upper limit of Kaumara. I thought that less than 5 years of age, usually the headache is what a person complains.
Because she's suffering from age of 6, this headache. But MRI everything was normal, sir.
So that will be a functional headache. If it is more Kava dominant, try to start with Prabhala, Varanadi, Kashayam and Kaisharu. Because most of the cases are Snayagadavada and Raktasadavada, but here the predominant history of Kabaja in nature in Ahara and Vihara, probably that may be Kabaja in type. If it's so Varanadi, Kaisharu, Guru, Tribhala. Tribhala like Rasayanas are powerful by because they are giving good Dadu Pushti at the same time Lankana. Tribhala is giving Dadu Pushti at the same time it is Lankana.
He has PCOD also, sir. Sorry, sorry.
Inevitably needed one
I,
course of admission.
yes. And sir, one more patient, 13 years old boy, means low IQ, sir. He is very poor in studies and very hyperactive. Means he will not think, he will just do it. He will whatever happen, he will not think what result will come, that activity. So his mom is so, they parents are so tired of him, and he every day
How
Shaya,
old is
13 years, sir, and Shaya Mutrata also.
that can be powerfully managed. That's why it needs multidisciplinary approach.
And Shaya Mutrata also, sir, every day.
He needs educational therapy. He needs behavior therapy. He needs our Ayurveda therapist. Along with that, we can manage it.
Okay, sir.
And my website and number is given in the text box. If you can log in my website ethicalAyurveda.com, you can ask questions. It's a text enquiry box is there. Otherwise, you can WhatsApp in my number. Don't call. Call is not entertained. You can WhatsApp in this number.
Okay, sir. Thank you, sir.
Reason why, because I am giving my personal number is that I am personally weak right now. Any other question?
Yes, sir. We'll go on to the next question. Sir, how to differentiate growth pain from others? Any specific nature to the pain?
Growth pain is not there. There is no such pain. It is a pain during the growing season. That other pains has to be differentiated in such a way that every pain has to be examined. Site of pain, nature of pain, variations if any, aggravating factors, relieving factors. Accordingly, you have to find out which dosha is. Usually in children, birth disease, then intrapelvic reasons, and sacroiliitis, and transient arthritis, Osgood-Schlatter disease. These are the several diseases which come across black pain. Have to give good examination. You try to read any differential diagnosis books of pediatrics like Suraj, because it's a big class.
Sir, next question. How to assess the fecal output, food intake, good conversion? Can you mention the quantity?
That is actually, it is a research point of view. One thing is sure, if the child is passed out fecal matter, after that, if you are examining the sigmoid colon, if the sigmoid colon is empty, his output is perfect. His output is perfect. Otherwise, there is residual constipation. So, by examination and history, together you assess that.
Sir, 2-year girl having slightly bow legs with vitamin D deficiency, but weight is good.
I told you, don't mind about the vitamin D. If the bow leg is beyond 11 centimeters, long distance, treat it. By Astihidana Sayanam. Rajanya Churnam, Ashta Churnam, Mahish Draugam, Gandha Thailam, Lakshadi Garpa Sasteni, extent of it.
The same person had a history of dislocation of wrist bone.
Probably he may be having weak Sirasnayu. Dislocation is not the problem of Asti. It is not the problem of Sandhi. It is the problem of Sirasnayu. Because if the Snayu, nobody is finding Snayu. Snayu is not only the ligaments, it is nerves. So, when the kappa is situated in the Snayu, joint pain will be the result. That is what is happening in osteoarthritis. Okay. Similarly, here the Snayu drug should be incorporated. and only it will be available.
Okay, sir. Sir, how can we treat hydrocephalus in children?
Very good treatments are available, not to reduce the head size in many of the cases, but even we are dealing with emergency cases of hydrocephalus, use the uh, intracranial pressure. We are giving immediate vasti, we are giving the Sisinduram with coconut milk. All these are the Mundayitva Shirasi Chadai Edustavasa Yada Ushadam Rajakam Savyachamutta Pravartakam. The same treatment principle of Vaishyajaratari has to be adopted. You will get a good result.
Sir, can you please suggest the treatment protocol for slurred speech? Slurring of speech.
I told you that is learned.
Kalyanagagrudha.
And Kalyana Avaleha Churnam Mukha Lepam, along with that Sirasnayu Kapavaranam and Udana Kapavaranam. This has to be managed. So Dashamula Vrishadi, Dashamula Nadutrayam, Dasonadi, along with speech therapy and behavior therapy.
Sir, treatment for Down syndrome.
Down syndrome has to be treated in 3 ways. Number 1, for the congenital heart disease. Number 2, for the floppiness. Number 3, for the intellectual promotion. For intellectual promotion, Prana Udana Kaphavarana treatment. For that, as I told you, 14 days of treatment once in 4 months are inevitable. And in that, Udvartanam, Takradara, Dasamunishira Parishaka, and Shiradara only. And for the floppiness, we need to manage by Ruchakarma like Udvartanam and Kodikidi, Churnapinda Swedam. And in older age, Down syndrome, Vamanam is highly challenging and Vamanam is highly helpful. Buddhi Prasadam Balamindriyana. Vamana gives good results. And congenital heart disease is an entirely different topic for the management. Principle is Kava Pitta Shamanam, because Shonita Kapa Prasadajam Krudayam. So Shonita Kapa Prasadajam, Padolagadrohinyadi, Uduchadi, such a drugs has to be incorporated if the defect is less than 6 mm. If the ventricular septal defect or atrial septal defect or endocardial cushion defect is less than 6 mm, treat it with Ayurveda, you will get 100% results. If it is above 8 mm, it will produce a lot of Eisenmenger phenomena. Eisenmenger phenomena that will lead to pulmonary artery hypertension and death will be the result. So, if it is more than 8 mm, send the case for surgery. If it is less than 6, do with Ayurveda. I am skipping the 7 mm because I cannot say it. That is the reason why. Don't worry.
Sir, we have Dr. Jyoti raised her hand. Dr. Jyoti, you can speak. Jyoti, you can speak now.
Yes, sir. In children's from 1 year to 5 years of age, if a patient comes in acute condition of Shwasa, can we give Shwasanandam Gulika?
We can give, but
Sir, not audible, sir.
Not audible, sir.
we can give Shwasanandam, no problem, but result is not a problem.
Okay, sir. Then what can we give rather than Shwasanandam in acute cases?
Cases I won't manage.
Okay, sir.
Okay. Sir, next question. Sir, some children presents with white patches in nail or in skin. How could it be managed through Ayurveda?
Slashma Tojistidam Kudyal Stabdam Shveda Avabasadam. Slashma Tojistidam Kudyal Stabdam Shveda Avabasa. Pandu Jirsa.
Okay. Sir, how to manage a hyperactive kid?
1 minute, I am just changing my location for a while. 1 minute. Hyperactivity. Hyperactivity management is in need of a big teamwork, of which one clinical psychologist, one speech therapist, and one Ayurveda doctor should be present. Of which we are treating the case as Vada Vaiti Gunmada. We are giving we have, if you are logging into www, I will type www.aditi.in. This is a franchise system. Aditi.in. In that, we are managing all developmental disorders, and we are teaching Ayurveda doctors how to manage developmental disorders. We are teaching means if they need our franchise, then only. Otherwise, we don't. But we have already 5 branches are running. 5 branches are on construction. By next month, it will be 10 branches of Aditi in Kerala. 2 will be in Kuwait. And the thing is that Ayurveda people are having good trust area to manage all the hyperactivity, autism, cerebral palsy, and everything. But the peculiarity of Aditi is that you won't get much more profit rather than more than 90K per month. It will not be available because I have arranged its bylaw and fee structure and salary structure according to that only. You cannot earn much, but you can satisfactorily manage 40 children in your clinic. I won't allow more than 40 children to be managed in a single Aditi because that will turn to big commercialization. So just Vadavaitika Chikitsa, Vadavaitika Unmata Chikitsa is the chikitsa of attention deficit hyperactivity disorder. Only thing is that there are certain people who are aggravated with Grudha application. It should be understand that they are Sama Pitta. In that case, Tikta Pradhana Dravyas has to be given like Tiktagam Kwadam, Sudarshanam. Such medicines has to be incorporated. That's it.
Sir, can you please tell us the treatment of Staulia in children?
Staulia Dustigilsia, but in children it is good to treat. But you have to find out whether the Staulia is primary or secondary. If it is secondary to any other diseases like Addison's disease, hypothyroidism, don't try to treat it with Ayurveda, better you go for endocrinologist. Otherwise, you can treat it very well by the principle of Staili Chikitsa. What I am giving is, as I told you, we are not supposed to reduce the Dhatu Poshanam. Tribhala usage, Gomutra Sadhana, Shilajadu usage, Tribhala usage, Varadi Kwadam, not Varanadu, Varadi Kwadam, and usual Uddvartanam, and the diet has to be customized thoroughly and exercise. We have certain packages. You can read it from that book. That is best. And compared to adults, we are getting good result in children. In adults, it will be very difficult because they are lazy people.
Sir, what kind of fruits to suggest generally in children and which time is the best time? There is so much confusion regarding the time, it seems.
Which one? Fruits.
Fruits to suggest generally to children.
See, every fruit can be given. Only thing is that the Guru Snigdha fruits like avocado has to be avoided if the child is not having sufficient agni. Otherwise, almost all the fruits are Lekhu Sandarpana, except certain fruits like avocado, chiku, like things. Otherwise, most of them are Lekhu Sandarpana. Whenever they are having good appetite, you can give it. Don't give as a customary marriage. Like it is 5 o'clock, let us give fruit. Not good. If the child is hungry, if the child is in need of it, you give it. Otherwise, don't give it. And usual time, what we are prescribing is snack time only, like morning snack and evening snack.
Sir, usually in children, as a skin condition, we see fish skin. Sir, can you please comment?
Matsyasagalobamam. Matsyasagalobamam. That is a fish skin. And see, skin disease is a broad topic, you know.
Yes.
And in YouTube, you try to type Dr. Dinesh KS Management of Skin Disease. You will get a 2-hour lengthy class for free, which I took for a college and somebody recorded it and uploaded it. And even right now, that is a tutorial for many colleges. So try to hear it.
Okay. Okay, sir. Thank you. Sir, Shida Pitta in children, what should be given if they have recurrence along with Pratishaya?
Usually we are giving Purnamadi Kwadam, Avivati Rajanadi Haridraganda combination along with one beautiful patent medicines like Histandin, Dimbarjanyadi. Any drug which is having Shonita Kappa Prasadaja activity. That means Kappa Pitta Shamanam, Resam Rektandadu. If it's so, Purnamadi, Shodidamradam, Pajanamradam, Panchatiktagam, all these are the drug of choices.
Sir, almost we have finished the questions in the chat box. If any of the participants who wish to speak to sir, you may do so very fast. You can unmute yourself and speak to him. Or else we'll wind up the session here.
Yes.
Sir, I hope we don't have any questions right now.
Yes.
So we slowly wind up the situation. Wind up. As you are also a little bit tired, it seems.
Not a little bit. I am too tired. Okay. Thank you.
So once again, let me thank you, sir, because pediatrics being a sir, in between, I have got a question. Sir, can I ask how to treat pre-diabetic kids?
Rectum pittam abhicchine kapado mutra samsarayam. Treat the pitta dosha, not the kapha dosha in diabetes in children. Most of the diabetes are paithiga in nature in children, type 1 diabetes. So Tiktakam Kwadam, Vishakatagadi Kwadam, don't use Amalagi. Instead you use Tiktarasa Pradhana Dravyas. And we give this Vishakatagadi, Nimbamradadi, Uguru Tiktagam. These are the different, only thing is that it should be Kladasoshanam. It should be Kama Pitta Shamanam, means Pitta Kama Shamanam. So Kaishore Ugulu, Ugulu Tiktagam, these are the different medicines but we are using, along with some patent medicines for hypoglycemia.
Okay, sir. So we'll wind up the session here. So once again, thanking you, sir, as pediatrics is a scary place where general medicine people can touch. So you have very beautifully explained the OP level management of different diseases in pediatrics. So thank you so much, sir. With this condition also, you explained so very well. Thank you very much, sir. Thank you. So now I have a request to our participants. Please give your suggestions. We would love to listen your feedback. So just unmute and please give away your suggestions. Because your feedbacks means a lot to us. So just give us few feedbacks. Anyone?
Hello, ma'am.
Yes, Dr. Monica, please.
Ma'am, just I want to know out that the previous sessions which we have got already, in those sessions, the last जो हमारा question answer session होता है, I think that has not been recorded.
The last two?
Yes, मैम. मैम जो भी हमारे पहले के सेशंस हुए हैं ना, उनमें जैसे अभी हमारा ये लास्ट का क्वेश्चन आंसर राउंड होता है ना, तो इसमें मैम काफी नॉलेज मिलती है. तो आई थिंक this session has not been recorded. It had not been in that recordings.
We'll just go through the recording and we'll let you know soon. Okay?
Yes, ma'am. Please, if possible, do share this also because it is very helpful. This question answer session is very helpful.
Yes, this session is totally recording, including the question and answer session.
Okay. Okay. Thanks.
Okay. Thank you, Dr. Usha.
Okay, so we'll, Dr. Jasul, we will wind up the session.
Yes, sure.
Ma'am,